over with Brooke Allison from MAP International.
Yes. Hello, everyone. My name is Brooke Allison. As mentioned, I am with MAP International. I'm the program manager here. And so something that I like to do when I enter a meeting or a space where I'm hoping to make meaningful connections, I just love to acknowledge and show gratitude for the superpowers that everyone brings to the table and brings to the room. So with that, I think that when we recognize those, we can hopefully humble ourselves to, build strong partnerships, fill in our own gaps and weaknesses where they exist, and together serve the people that we want to. So just taking a second to thank Spoken here, who's also presenting today. I grew up in a community where 73% of the students in the school district I attended either didn't speak English or English was their second language. So thank you for recognizing the impact that can come from being able to simply communicate in an understood language. To unite us for recognizing that no one person, no one clinic is an island. And by creating these ways that we can make the referrals, we can hopefully continue to break down the barriers that exist in getting people the care that they truly need. To the healthcare providers, to the administrators who are here today at the clinics, thank you. You see and you saw the need to care for those who otherwise would not have been cared for. You extend kindness, patience, love, in the best ways that you know how. All will literally change and saving lives. To TCCN for creating this space where we can make these meaningful connections, where we can bring our superpowers to the table, where we can learn of each other's superpowers, and hopefully fill in the gaps to make sure that everybody who needs care has it. I'm thrilled and honored to be here today to share with you and to present MAP's domestic medicine program. So with that, MAP was founded about 68 years ago. We have been a recognized leader in the global health space. Our strength has been in the acquisition and distribution of large volumes of the most needed medicines around the world. We have developed specialty programs such as heart valve replacements, addressing Chagas in Bolivia, Ethicon sutures for specific procedures, and pharmaceuticals to treat every disease category. Additionally, we serve in disaster relief around the world and here in the United States. Shortly before 2017, we wanted to expand our work in the United States beyond just the disaster relief that we were doing. And so our initial thought was that this would be an outlet for our short-dated medicines that we could not ship internationally. We would need this new, large, beautiful warehouse to move volumes and volumes of pallets and products that we were not able to ship before. But before jumping in and doing all of this crazy work, we contracted a feasibility study. We wanted to understand how best to set up our program to serve our future clinic partners. The things that we learned were, one, clinics did not want pallets of medicines arriving at their door. Two, clinics did not want short-dated medicines, and they did not want the medicines that nobody else wanted. And three, clinics already have access to a variety of similar programs where they can receive volumes of products. But there were still gaps that existed. And those gaps that we heard time and time again through this feasibility study were the regular and consistent access to medicines. These patients who need these medicines don't need it, just once. If it's a chronic medication, they need it ongoing, specifically with these chronic disease medications. So what did we do? We took a step back and recognized that our experience internationally has led us to our goal of being needs-driven to build and support these strong partnerships that we have. So with this in mind, we created our domestic medicines program to fit the needs of the clinics that we're serving. What does this mean? It means that we have kind of a small formulary, but these medicines are consistently available pending supply chain issues right now, as everyone knows. These medicines address asthma, diabetes, hypertension, cholesterol medications, and basics like antibiotics. They're all purchased medications by MAP that are long-dated products, so that when you receive them, you have plenty of time to dispense them to the patients that you need. Additionally, you're able to order what you need when you need it. There's no surprises, there's no large shipments unless you want them. If your pharmacy is an actual pharmacy, or maybe it's just a cupboard, we've got you covered. Finally, we are needs-based and needs-driven. So if you share what you need, we do our best to make it happen. This includes recently we've learned of a lot of clinics are spending a bulk of their budgets on psychotropic medications. And so we're taking a step back and seeing how can we find access to these to make sure that our clinic partners have access to these as well. We provide larger bottles of a lot of the medications. So we were hearing from our partners that they needed pill bottles, they needed plastic bags to serve the homeless population, they needed pill dispensers. We're providing hypertension medication, but can we find a way to provide the blood pressure cuffs that they need to monitor their blood pressure at home to keep an eye on the ups and the downs? So all of these things that I've just listed are on our formulary. I'll take a moment and flash the formulary that MAP International has pretty consistently available, again, pending supply chain issues, pending maybe we learn of something else that's needed. So let me go ahead and share that formulary so that you guys can kind of see what are some of the things that we consistently have available. So again, we focus on chronic disease management so that we have regular, consistent access to the medications that your patients need. Some of the other things that we look at, again, the basics: antibiotics, acetaminophen, aspirin, the basics that we know that are regularly needed, but a lot of times people simply can't afford or don't have access to: prenatal vitamins, multivitamins. And then again, the supplies, things that we know that if we don't provide them, you're going to have to spend your budget on them. And if you spend your budget on things like table paper, you're not spending your budget on the capacity building that you need to serve the patients that you do serve to the best of your ability. So with that in mind, we've built our formulary around that model. Right. If this sounds like something that you would be interested in participating in, at the end of the presentation, I'll provide my contact information on the screen while you guys ask questions. We do have immediate funding available to take on new clinics in Tennessee. And also so that we can, start the onboarding process immediately. We have further funding in the works and are in an active growth phase of our program. I would not be here today if I did not feel confident in the ability to bring on these new clinics that are here to serve the beneficiaries with you all. Please note that if everyone on this call emails me this afternoon, it might take me some time to work through and get back to each of you. But really, we are thrilled and honored to be here today to present to you this program. So let me go ahead and share my contact information. Feel free to ask questions. We try to keep it really simple. We recognize that, we have our onboarding process. We recognize that we need specific information in order to make this happen. But once it's available, one of the things that we hear back time and time again from our partners is that it's simple, it's easy, because we want you to get the care or get the medications for the patients that you guys serve. So here's my contact information. Also find me on LinkedIn. I love to watch the growth of the clinics that we work with, the people that we partner with, to see what we can do to continue to expand the work. With that in mind, what kinds of questions might there be?
I have a question about, you mentioned that members don't want to get, palletfuls of anything. What kind of quantities, how do you do that? Can you speak to that?
Absolutely. So we send you pretty much the formulary that I flashed onto the screen. I can do that again if needed. We send you that formulary. You can order quarterly, you could order monthly, and you simply ask for, some of them are boxes, some of them are bottles, some of them, whatever the quantity that's listed there. You can order as many of that as you would like. So we know that some of the clinics are quite small. Maybe you need 5 bottles, maybe you need 10 inhalers. Whatever that is, we build the orders based on what it is that you request. And I saw something flash through about the formulary. Yes, we can email that through.
Great. Any other questions? Y'all don't be shy. I think you did a great job, and I have to personally thank you for the beautiful opening.
Yeah, absolutely.
Yeah, that was gorgeous. Thank you. Allison wants to know what are the eligibility criteria to participate?
Yeah, certainly. So we ask, as all of you are very aware of, that you're serving the uninsured and underinsured patients. We ask that the medications that you dispense from MAP are given to the patients and beneficiaries free of charge. So we don't want there to be a transaction for the medications that you're handing out that are MAP specific. You obviously have to have the capacity to dispense medications. If you don't, but you partner with, for example, in Georgia, we have St. Vincent de Paul that helps clinics dispense medications. If you do have partnerships like that, feel free when you reach out to kind of walk me through what it is that you're doing, and we can find a way to partner in that manner. We do have some data feedback requirements, but we also want it to be known that we never want data to be a barrier. So we ask, the number of patients that received the MAP medications, and then, if we can track it to, let's say, if we can track it to how many patients received the hypertension medications, how many received the diabetes medications, we love to get that information. But again, we never want data to be a barrier. So we work with clinics individually if something is or isn't available. We have some clinic partners who have very robust EMRs. We have some who use like scanning capabilities, and we have some that still handwrite on the bottle all of the prescriptions. And so with that in mind, we're very cognizant of the capacity of each of the clinics that we serve.
So it sounds like all of our partners would be eligible as long as they're serving uninsured or underserved or low income. So even federally qualified health centers could access
absolutely.
this. Rural health centers would be welcome to,
Yes.
and of course, our own beloved members and friends that are free and charitable clinics. Okay.
Yes. Yes. And we don't ask for like proof of, like we don't ask for any of that information on the individual patients. We trust that, the people on the ground, the doctors, the clinics, they see the need and they treat the need. And so that's really where we build our trust and partnerships around that.
Beautiful. That's great.
Hey, I've got a question. This
Yeah.
is Kelly with Karis in Cleveland, Tennessee. Is there a subscription fee, like a yearly subscription fee that we pay to be part of the program?
No. So during the application and onboarding process, we look to see, based on the numbers that you provide, how many patients it is that you serve. And then from there, we kind of come up with a budget. So we say, like on our mind that you can spend X number of dollars, and it's not your own dollars, but we kind of manage it that way, making sure that, that's our way of managing the program and making sure that we have control of the number of medications and dollars that go out to each of the clinics, but there's no subscription fee or fee at all.
It's our favorite price point in free and charitable care. 0 to members.
Free. Yeah.
Yeah, I was really tripped up when she started talking about the budget, and I was like, and then she said, no, it's our budget, not yours. You're fine.
Yeah. So we just, use that as our way and base it around the number of patients. However, we also know that clinics grow and clinics expand, and you can have one location when we start and 3 years later have 4 locations in a mobile clinic. So you're not held to anything, but again, that's just kind of the way that we track the process.
Beautiful. Any other last questions before we move on to Spoken Here and Kim Beck? All right. Well, thank you.
Wonderful.
Thank you so much. All right, Kim, are you ready to jump in and tell us all about Spoken Here? I will say before I let Kim say another word, I learned about Spoken Here from our beloved partner, Music City Prep Clinic, who introduced me to Spoken Here, and I was just sort of gobsmacked at the model and how well it worked for Music City Prep Clinic, but really so many of our members have been asking about translation services and are paying with some fairly restrictive contracts and that kind of thing. So we said we got to bring Kim back and let her tell us again about Spoken Here, because more people are ready to hear about it now, I think. So Kim Beck.
Thank you, Mary. I appreciate you inviting me and letting me talk about Spoken Here and what we do and our partnerships with existing TCCN members, and hopefully we'll gain some new relationships through this. So I'm sorry, you can hear me, right?
We can.
Yes.
We can. No, our friends from BrainLinks were just saying that they have loved working with you for years.
Yep.
They were just giving you a shout out.
Yeah, I was just about to say Tennessee Disability BrainLinks, We've been working with them for years and years now. I don't even know how long. It's been a long time. So, basically, just to introduce myself, I'm Kim Beck. I'm the VP of Remote Services at Spoken Here. I've been in the language industry for about 10 years now. However, our CEO and senior management, myself, we've been in the business for about, over 30 years between us. He's been in it the longest, our CEO, about right at 30 years. And we've, like I said, senior management's been in it all 10 years plus. So we have a lot of connections and experience in that area. Prior to working in the language industry, though, I was working in the nonprofit area. So I have a background in that as well in Tennessee, as a matter of fact. I worked for a couple local nonprofits, both as a volunteer and as an executive director. So I have that background and have a little bit of insight on things that nonprofit, or the unique needs that nonprofits have when requesting money, spending money, things like that. So I can, I work with all of our nonprofits and, provide information. And I'll talk about that a little bit more in a moment, but just can provide you some information that can help you when you're writing grants or, showing where money's spent, things like that. So, but I do want to share my screen here. I'm sorry, I'm a little bit sometimes technically challenged, so I think I have it here though. Okay, there we go.
No worries.
Yeah, okay. And so basically though, I'm sorry, did you hear me?
I think you're fine. You might want to put it on slideshow.
Oh, I sure didn't mean to. From the beginning, there we go. Yeah, I had it all right before this, and I was a bit frazzled joining late, so I apologize. I wasn't quite ready. I was ready, but just a little bit off there. So, basically, though, Spoken Here, we're passionate about people and relationships, helping people connect through our ability to, utilize languages. We do more than translate or interpret from one language to another. We look at it as building relationships. We like to, we want to build relationships with people, and we want to help you build relationships that are meaningful and lasting. Through our assistance, our clients are able to, enrich lives, grow their organization, and build a healthier community. And like I said, on a side note, though, I am a Tennessean as well. I currently live in Tennessee, but I was born and raised in Tennessee. And our CEO is from Chattanooga, Tennessee, although he does live in Texas now. But I told him we'll still claim him because he lived here for a long time. So, but I love it. The ability to be able to, work with anybody in Tennessee. It's awesome. Love it. That just is a plus for me personally. So let me, like I said, I'm sorry, I'm a little bit challenged here. Here we go. So we are, my slideshow, there we go. There we go. We are a full service language provider. But specifically today, I'm going to talk about our, I'm sorry, those are just some clients that we have that are Tennessee. I don't mean to scan past everything, but I'm not going to read the whole thing to you because I know that's boring. So,
no, but I'm not even seeing any of your slides move. Is anybody else seeing the slides move?
No.
I'm wondering, would it help is there a way we can help with that, Annabelle?
Is this the slideshow you sent me previously?
I'm not sure if it is. I think it is though. The one that has, yeah, I think it is. Now that I'm thinking about it, may added some.
I can open it for you. Let
Sure,
me make.
Yeah, so maybe you can unshare and Annabelle will share your slides so
Sure,
everybody can
sure,
see.
that would
'Cause
be great.
there's some really good information in there that's not showing up. Thanks.
Mhm. Okay.
Hold on. I need to find my screen.
And just while she's doing that, I'll say that, you know, like I said, mentioned, we are a full service language provider. So, and that mean, when I say that, I mean, we do anything and everything to do with languages, not just remote interpreting. We have document translation, website translation, marketing forms, any type of translation that you need, we can do. We have voiceovers, subtitling, captioning, really anything. Like I said, if it has to do with language, we can help you. And we do everything in over 300 languages. So unless it's something really obscure, we can probably help you. And I just now noticed that, yeah, I did change a couple of things because we have recently upped our languages. That just says 220, but it is now 300, and I have an updated list that I can send out so that you guys have all the updated information. So if do you mind go ahead and clicking to the next slide though? Oh, well, I'm sorry. I guess I didn't tell you. Our remote interpreting platform is called Connect Now. That's what we call it. It allows you to connect with remote interpreters instantly. Our, you know, you never need an appointment. Our interpreters are HIPAA certified. They are available 24/7, 365 days a year for all of our audio languages. We have video interpreters in about 22 languages. Those are available 24/7 during the week, with the exception of sign language and Spanish, and those are available 365 days a year. So those are, you know, those are the most used ones of the video languages anyway. You can connect, we offer multiple ways that you can connect to our platform. You can log on to any device that can get, you know, you have a computer, I'm sorry, internet access. You just need a web browser, or you can download our mobile app and connect that way, or just dial, call our phone number and select the language that you need, enter your access PIN, and boom, 12 seconds later, you're connected. And that's about our average connection time. Occasionally you might run into maybe 20, 30 seconds if we're really, really heavy, but that is extremely rare. I average it every month, and we hit right at 10 to 12 seconds every month. So like I said, our interpreters are HIPAA compliant as well. So all the security and things have been, you know, reviewed on that. Nothing is recorded, so all your patient information is protected. Again, that's incorrect. So we have over 300 languages now, including American Sign Language. And we do offer a custom solution that you have real-time call logs and custom reports. You have a dedicated account manager. You have a support, and you know, we do offer training as well. So you know, once you on board, we have a training session, or we could do a couple depending on your team size. That's up to you. That's all included. We are an ISO certified company as well now. And if you could click to the next one, please. Okay. And because I was using it for my notes, so I apologize. There we go. So we do offer we provide a custom solution. We look at the things that you need. I mean, we realize all our clients are different, and you need different things. So we, in the beginning, we sat down, we talk about how do you want access? How do you want to control access? How do you need your invoices or the information you need on your invoices? Any type of documentation that you might need, things like that. And we look at all that and we put together a solution specifically for you that answers all of your needs and, assist you in the way that you need assistance. Okay, click to the next one. And these are just some of the standard information that when you log into the system, you can get, and it also comes on your input as well. So you just have standard call time and call data. We can collect custom data, so you would just let me know if you needed something specific, something outside of that list, and we can get that for you as well and provide that each month. The next slide, please. And I did mention this earlier as well. I can do custom reports for you. So like if you're writing a grant request and you want to know how much you spent on a particular language or a particular program, things like that, or just information for your area, maybe. I can get things like that and send over to you. And I think the next slide is another example of that. Or like I said, I can do what you've spent, and I can also do projections based on trends and things like that. And I could do it by language or by program or location. Sometimes, clinics or nonprofits rather have programs, or they may have multiple locations. So that was why I said that. This is just a language list. And that needs to be updated, but I do have the updated one for you. And what's next? Let's see. Oh, yes. These are just, it's very simple to connect. So like I said, you can dial a phone number, enter an access PIN, state the language or type in the language that you need on the keypad, confirm it, and boom, you're connected. And that's it. That's one of the easiest ways. If the patient is there with you, you can have your conversation right there just on speaker. If you're calling maybe to set an appointment, you can call and you can, conference everybody in, or you can call our interpreter, give them the phone number of the patient, they can call and conference everyone in that way. So you have multiple ways that you can add callers. Okay, the next slide. That should, our web browser. So any device that you have that can connect to the internet, you can connect to, as long as you have access to Chrome or Firefox, because those give you access to all features. So if you use one of those two browsers, you can log in, and you'll click a little button right there. It just shows you, that's just a little example, but it's really that simple and easy. You click the little microphone button, a window opens up, you select the language you need, and then you select the camera for video or the speaker for audio, and then call. Again, it's about a 12-second connection time. And the next one, and that should be our mobile app. You just download that. It's very similar to, you have the same login. It's very similar to the web application, the call window. You just select the language and call. Again, you can, if you're using the web browser or the mobile app to add a caller, you can let the interpreter add them, or once you connect to the interpreter, there's like a little plus button, and you would just click that and dial your phone number. It'll pop the keypad up, the dialer pad up at that point, and you could dial someone in that way. Or if it were video, obviously you can send a link. It gives you the option to send the link, and when you do that, the person does not have to log in or download anything. They just click the link and they're there. It's very similar to Zoom in that regards. In fact, we're integrated with them for our video services. So, that's it as far as how to connect. As far as how our services work, there's absolutely no setup fees, no minimum fees, no call fees, nothing like that. basically we only charge, we have per minute rates. We only charge for actual usage. So if you don't use, you can set up an account, have everything ready to go so you have access in case someone walks in. Whether, you can have it ready whether you have somebody regularly that comes in or not, or if you just want to have it just to have it, to make sure when you do have the need, you can set it up, have it there, ready and waiting for you, and you're never going to get an invoice if you don't use it. So, that's a great thing as far as, really anybody. I wouldn't want to pay for something that I wasn't using, but I liked how, I would like having access to that if I could. So, we try to treat people the way we want to be treated. And that's why we, set up our service like this. So we have no charges unless you actually use it. And at that point, like I said, you're only charged for your actual time. A lot of companies will do like a minimum 15 minutes or an hour or none of that. If you use it for 1 minute, that's what you pay for, is 1 minute.
And Annabelle is reminding me that TCCN members have a special negotiated rate with you all as well.
I was just about to say that.
Oh, I'm sorry.
Oh, no, that's okay. No, that's okay.
Wait, I just love that part.
Yeah. So we do offer a special rate for all TCCN members. I will ask you to call me so that I can look at it, because basically I look at several things. If you have locations, if you have a call volume, things like that, that could also lower your rate. So if you contact me, I can look at multiple things and give you the best rate for your clinic. And but everybody is going to get right off the bat TCCN rate, so you're going to get a discount to begin with. And so we also have an additional incentive, and I almost forgot this, but we do have an additional incentive this month. We have a promotional summer promotion going on, and so if you sign up for our service before June 30th, you get $50 off your first month of service. So you could actually, so that means you can sign up, there's absolutely zero cost, and then you get $50 bonus to try it out, whether you have a need or not. You could just test it out, see what you think, but it's really easy. We love it. We love being able to help people connect. I've witnessed, and I've been told many times that, just have someone having access to an interpreter, being able to communicate in their native tongue, improves their, the outcomes of, they understand what you're asking them. They understand the instructions, medications. They can provide feedback on any side effects, things like that. And so basically you end up with someone that trusts you and is going to fully participate in their health. And, in the end, you're going to get, a healthier patient. They're going to take care of themselves better. They're going to take care of their families better, because they know and know that they can come to you, trust you, and, trust that communication that they have with you and that relationship that they're building with you. And, it just makes for, like I said, they're going to be healthier. They're going to take, their family is going to be healthier. The community is going to be healthier as a whole. And so it's just a win for everybody, I think, when you can, communicate. It's all about, life is about relationships and connecting, I think. So we love that part of it.
Well, that is excellent.
Questions?
Yeah, questions. We've been telling our members as we go around, the difference, because I know a lot of folks, are working with interpretation services that do have a minimum or contract fee that, so we just, been trying to let everybody know. Folks, anybody have questions?
Yeah,
Okay.
I've got some
Okay.
agencies that would probably be really interested in this that maybe are not members of the TCCN. But like, I don't know, I see the question being like, what would be the average like phone call cost? So if there was like one call that they had, what's probably the average per meeting? Like if it's like a 10 or 15 minute call?
Oh, Well, wow. It could range. I mean, because it does vary, like language too. So like if you're, sign language, that's the most expensive. You're talking video. Spanish is the least expensive. Average for maybe a 10-minute call could be anywhere from, 10 to maybe 13, at the most, $10 to $13,
Yeah.
somewhere in that range. And I'm just ballparking it here, average. Like I said, it could be a little bit more, it could be a little bit less, but that's about average, I would
No,
say.
that's great. It's so well worth it. I just wanted to know, just in case I do get asked if I bring that to folks. But no, I mean, it's so worth it. And I mean, for that many languages to be offered, I mean, that's great.
And Kim,
Yeah, and I mean, mhm.
oh, I was just going to say, should folks reach out to you? I saw there was also a business development contact. How do you want people, if they want to take advantage of this, one-time offer to get connected in June and can use that $50? Would they reach out to you or the other person?
Directly. You can reach out to me directly, and that's fine. I mean, if you don't reach me, you could, call one of the others on the list, but chances are, if you don't get me, leave me a message and I'll call you back within a few minutes. I had a call yesterday at 5 a.m. I wasn't up, I must admit, but it took me about 5 minutes and I called her back and she couldn't believe it. So, but I try to be there and answer all, help you, whether it's a question or whether you're having, panicked because you didn't realize which is what yesterday was. Someone didn't realize they had something coming up and they're like, oh no, what do I do? She hadn't used the service before. So she, I just walked her through it again really quick. She was just she was just nervous, first time using it, but was not an issue. And, I was just going to say that, like I said, there's no set, we don't charge any minimums, but we also don't lock you into a contract. I'm sorry, that's what I was trying to say. We have a service agreement that just lays out our relationship, like our rates, our confidentiality, things like that. It does not lock you into any time frame. We want you to use us because you like us, you like our service, you feel confident in us and, in our abilities. We don't want you to be, stuck to us because of a contract somewhere,
Right. Any other questions before we give Jeffrey a chance to tell you about what they're doing with Unitas? And Kim is very responsive, so do reach out. So Jeffrey Johnson is going to update us. Many of you have, been aware of Unitas. Some of you, I know Sarah Wells has been using Unitas since they came to Tennessee. So we're kind of a new state for them. So let's let Jeffrey tell us what's going on. Welcome.
Thank you, Mary. I appreciate the opportunity to speak here, and it's always just a great place to be, where a lot of like minds are around and serving the community, and especially the charitable work. I mean, that's so many folks that, especially in our rural areas, just because I'm from rural West Tennessee, don't always have the insurance or don't always have the funds even for a sliding pay scale, or so it just depends. But I'm really thankful just to be here around a lot of folks that are truly dedicated to helping the community. I am still licensed clinically, but I'm not practicing anymore, so it just makes me feel like I'm kind of like with you guys still. But yeah, so I want to share a little presentation. So for you guys who haven't, this is going to make me, maybe I won't share, because it's going to make me do some privacy settings for this app, because I'm not that's okay. I'm not a Microsoft user.
Send it to me and I can share it.
Maybe this will work. Is that pulled up? You can see that?
Yes.
Cool.
Yes.
So I won't talk about this just yet. I'll kind of talk about, for folks who haven't heard about Unitas. We're working to build a coordinated care network across the state, and in the name of reducing social determinants of health. And so our kind of idea is that for a long time, social and healthcare have been fragmented or siloed. And so if we can connect these industries, people are going to feel like we have true wraparound services in the community. They're going to feel like it's more trauma informed because they're not going to have to keep repeating their story. And they're going to truly feel like we're collaborating on their behalf. And so I like to call Unite Us infrastructure for what you guys are already doing, because, for instance, you guys are all in the TCCN, which is a network of folks helping people. And I'm sure outside of that, you guys are probably on cabs and doing these community advisory meetings pretty often and working on serving your community. So all we're doing is providing an infrastructure to do that work more efficiently. So we don't think we're like the answer to your problems. We just think that we're part of helping you to the solution that you've already found. And so for people using Unite Us, I mean, I joke about this. It's a social media for social care. That's kind of what I call it, except for sometimes people don't think it's HIPAA compliant when I say that, and we are. But for somebody who has a license to Unite Us, like say a caseworker, it's a way to send and receive referrals. It's a way you could do case management. It's a way you could find organizations you haven't heard of before. It's a way you can contact other agencies and clients. So there's a lot here, and it's all paid for by our funders. And so all of the agencies that want to join Unite Us are coming to the platform. You really just sign a registration form to let us know about your agency, what programs you guys offer, or if you don't offer programs, just more about your information and who your contacts are. But let's say a case manager gets a license on the day-to-day usage. If somebody shows up to your agency, you're screening them and you're seeing how you can help them inside your purview. But what we know is, specifically, if someone's dealing with food inequity, well, there's probably a meaningful employment opportunity that needs to be had there too. If they've got children, there's probably a childcare need. And if they're dealing with food inequity, there's probably a physical healthcare need as well. And so some things are just outside of our purview, but we still want to show impact that we were maybe the starting point for somebody, the first point of contact. So when someone comes into our agency and they've got 3 needs outside of our purview, you can refer those needs all at the same time for all 3 things through the Unite Us platform, and then continue to track it. So at the end of the month, you say, well, my clinic helps do, we solved 80% of the cases that we do within our purview, but we also help 60% of our clients get childcare. We help solve 80% of these food inequity needs. And we got people some other mental, behavioral, physical healthcare outside of our clinic's purview too. And so we want to prove the impact that you guys are making in the community, even if it's referring to a need outside of what you do at your agency. And that's kind of what this slide is showing, which I guess I could have had that pulled up for you guys while I was talking about it. But this is an example of a Kentucky housing agency that's done some similar things like that. They've done their own needs and kind of worked on those cases. And then they also prove the impact for the needs outside of their purview. Unite Us, like Mary said, is pretty new in Tennessee. I mean, our first launch was right before December of last year. And so even though we're in over 40 states, Tennessee is brand new because we're called ahead of revenue. So Unite Us has been promised and done so well in other states that even though we hadn't had funders, they decided to launch anyway. So now we do have some funders in Ballad Healthcare and the Strong ACC network. So we're continuing to expand, and I'll share some exciting news in the pipeline at the end here. But one thing I wanted to talk about is, like, specifically North Carolina, a state where we've been around since 2013 when we started. The typical time from when someone made a referral manually, whether that was a fax, an email, trying to call someone, it was 14 days for one of their clients to access care. Now, it's 2 days is their average. And so we're not trying to say that people don't have networks or that you don't know who to send them to, but this just makes things more efficient for you and the client themselves, because we're taking a lot of it on their behalf. And so 16 days to 2 days is a huge gap in reducing that time to access care. So we love that. And then that leads to the enhancement. But one thing I want to talk about, which is so important, is more resources, specifically my rural area folks. I mean, as I'm working in West Tennessee a lot more, it's like, well, we don't have the funding for that, or we're not really sure how to go about that, but there's opportunities out there. Department of Health and Human Services just launched a program where they're going to be giving out 30 awards up to 300,000 apiece. And it's for reducing social determinants of health programs and trying to establish those at your agency. And so Unite Us language can help, speak to that innovation in trying. And it's not just a state thing. The nation is going to be taking a look at social determinants of health more and more. And so it does lead to more resources because we can prove, especially like thinking about Nashville where I'm at now. It's like I read a report that we're 20,000 houses short. And so being able to prove that 60%, 80% of our housing cases are unmet every month or year proves that we need more resources to develop programming or housing, whatever that might be. And so I wanted to speak on that. And I also wanted to speak on our privacy. So a lot of folks, specifically at like my clinics helping women, like we have some domestic violence organizations on, maybe our mental health partners. We want to make sure that we're protecting them. Unite Us was created to help the client first and to feel like community care. And so we are HIPAA compliant, but even more than that, we're high trust certified, which is specifically around tech. We're SOC 2 Type 2, and all of these other acronyms here that we talk about, kind of our alphabet soup, because we want to make sure, because every agency's got their own privacy standard, that we try to meet that for them. And so we want to protect that. So even our folks with sensitive data types, the information is not shared the same way as if it was a food inequity, or if it was maybe a social need, like maybe they're doing they need a recreational group. The domestic violence cases, the HIV/AIDS cases, the mental health, all of these things are protected even more. So people aren't actually seeing what they're being served for. So what we're doing is trying to really protect the client and provide services to them. I was going to do a demo, but just in case of time, 15 minutes, I could probably take an entire hour for Unite Us for you guys. And so I put this slide on here just so you could see what a client's face sheet looks like and kind of as it updates. So when I say you get access to Unite Us, it's a username and a password, and then you'll have your organization's home. But this is what it would look like if you were looking at a client. So as they're going through Unite Us, that tracking happens in real time. And so as cases are made, as cases are resolved, as we meet with clients, as we share them to other agencies, the people working at other agencies are going to be added to a care team so we can connect with them. You can see the cases that are open unless it's sensitive. Like, for instance, my Music City Prep folks, that's kind of a sensitive topic. So when they have an open case, they're not shared to other agencies that aren't working with them on that case. So they're not even seeing that they're working with Music City Prep. And all of the rest of the timeline is updated in real time. So I wanted to show that. And I'll stop sharing for a second because I want to show you something that you guys, I think, would appreciate moving forward, is our Insights dashboard. And so this is something that you guys get access to. So I say everything is like part of infrastructure, and we want to offer a lot of things to you guys because we want to be, I guess, full circle for your needs too. So not only do you get access to that platform where you can send and receive the referrals, we also want you guys to have data. This whole entire state network is being put together so we can look at the broad picture of Tennessee, or maybe our county, or maybe our city, or maybe just our agency itself. So you get access to 2 dashboards as well. One is the community organization dashboard. And this is all demo, so this isn't our real data. But first thing you'll see is our network coverage. So what's our footprint? So you can look at the type of agencies that are in the network, programs that are receiving referrals, and just kind of literally showing where we at. Another thing you get access to, and I know I'm speeding through some of this just because I want to make sure I'm within time, but one thing I love about this, and the example I always give, is something like, this is what's happening in our community most frequently. This is what people are needing most frequently. So as more organizations join Unite Us, as more people are sharing their client stories through Unite Us, it's de-identified, but what it's doing is painting a picture of our most frequent needs in our state, our counties. And so, for instance, let's say we're working on a grant for something and we want to look at a specific population. So maybe we're looking at our women who are between 18 and 44. So we can toggle to that demographic specifically in this platform. And we can say, okay, so the most common need for women in this demographic is education. So, what does education look like? So most commonly it's early childhood education. Maybe it's a computer technical degree, whatever that might be. So we can actually, really get into depth on what that might be. But then we can also see co-occurring needs. So if we're talking about women in this demographic, the most common is education. Well, what's the most common that goes along with it? So 31% of the time, they also have a housing and shelter need. Like I said, most of the time, if someone's got one need, they have 2 or 3 more. So I wanted to share that. Service events is just how active the network is. So I won't spend a lot of time here, but it's basically just saying for each service episode, this is how often it's happening in each month. And then outcome details is a big one. Because tracking is so important in finding out why services are successful or not, we want to put a lot of work into the resolutions of these cases. Like I said, specifically for housing and shelter, if 60% of our housing cases are unresolved, we need to know why. Was it because we didn't have the units? Was it because we couldn't get people eligible? Was it because they found housing on their own? These all things go into painting a true picture for what we're doing. And I know I'm sharing so much here. So I'll stop with the health equity dashboard, which is another dashboard that you get access to. And this is basically showing the demographics of population that you are serving. So this is another way to toggle through the platform and show for the folks we're serving, what does it look like for them? So we can look at our client needs again and say, for instance, why is it taking longer success rates for people in our demo environment? Why is it taking longer for people who don't identify as Hispanic or Latino to get case closures than it does for people who are? And so this really takes a look at that health equity to see why different populations are being treated or served differently in our communities, and how can we go about addressing that and kind of the future of our agencies. And so, like I said, I know I'm sharing a lot here. So I'll kind of stop there with sharing and kind of end with, I guess, a little bit of like some updates of what we've been doing. So one thing since I've met with you guys last is Camelot Care Centers have come on across the state, which is really exciting to have a statewide health partner in the Tennessee Health Link, kind of phase of this. We've gotten some TCCN members to join, which is exciting. I think there's 4 or 5 agencies within the TCCN that have joined. We're working with some agencies specifically to build programming using Unite Us, like peer-related self-sufficiency bridges, which is really fun. And then I might get in trouble for sharing this, but the last update that I'll share, because I set a timer for 15 minutes and I've got 17 seconds. So TennCare, so like I said, the state is focusing on this and the country is focusing on this. So TennCare put out an RFP for a closed loop referral system to be over the MCOs throughout the state. And, oh, there it is. And Unite Us feels pretty confident. I think I'm comfortable with saying we're pretty confident that TennCare will or does intend to work with us. Right now, there's a petition phase, which lasts 60 days. But there is intent on TennCare's side to work with us if we make it through the petition phase here. So within the next 6 months to a year, the network for Unite Us is probably going to triple. It's happened in North Carolina, was the first state government has been hand in hand with Unite Us, and they have over 3,000 agencies on board. And so we're looking at replicating our successes there. And so I'm really excited about the growth we've had. I'm now our state strategy director. I was our Nashville community engagement manager, which is also new. But we've got a lot of, great things coming in the pipeline. And like I said, the more people that get it, the access to it, like I said, it's free or paid for, I like to say, the more people that join and trust using it, the more we can take a look at our whole entire state or even our larger county barriers to what's happening. That's all I got. Thank you.
Wow, that was phenomenal and beautifully timed. And we may have to ask you to come and do a whole presentation at our conference this September on the 27th, 28th, 29th. Because there's a lot to get into, and this fits beautifully with the disparities work that most of our members are really, really focused on through a grant with the state, and also it's what they do. So it's what they do every day. It's try to
Thank you.
diminish disparities. So
I appreciate it.
Annabelle wants to say one quick thing before we hop off and give you your day back.
Well, actually, a couple of things. I want to update you guys in several things. As a reminder, first of all, that we need for all of you to complete an evaluation for today's webinar. The link is in the chat, and we will, of course, follow up and sending this also through an email. We want to know, how you feel about these kinds of presentations, as we discussed during the road trip, that we ended exhausted, but we still need to go to visit some of the members. The idea of these trainings is always either to bring a new partner so you guys know what else is new and what other connections we're making, but also making sure that we bring other topics, and we want to know more of what kind of topics you would like to see here, right? So if you take a couple of minutes, it takes 1.5 seconds to complete the survey. I'm not joking. It's really quick. In the meantime, let me give you some reminders while you complete the survey, that you should have all received an email similar to this one, telling you that you have been approved within your membership. This is our new member engagement tool, and this is really important that you go there and update your information, because a lot of details regarding our annual conference will be shared through the portal. And we are very excited about the annual conference. I have some details soon. So if you have not received an email like this, almost everyone should have received this by May 14th. I know that's a Sunday, but I'm sorry. That's when I finish approving everyone. And even our associate members have access to our portal. So you can also engage with our organizational members and exchange information, as well as, services and agreements and partnerships. So we're really excited about this one. If you have not received this, let us know. I know that since it looks like this, some people were thinking maybe this is not legit. Well, go back to May 14th and look for it, because it is. Sorry. And there is actually even a special portal within the system for board members with a lot of documents on it. Another thing that I have for you is reminders and news flash. A reminder that the disparities work plan and budgets are due. So we will start working, evaluating them next week. And we're very excited about this. So we hope that we can make your dreams come through, at least some of them, that the CDC will allow us, but they're there. So the other thing is that we got yesterday the extension of the equity grant contract. And that's the grant that was starting April 1st, and it's only for 3 months. But we're competing for the new round starting July 1st. And 19 of our members were already in this grant. And it's the one that started, when we started working as Project Finish Line with Sustento, that opened the doors for working on this grant with the state through the Tennessee Department of Health. So we get this. That means that we have additional money for you guys, and we're going to be sending a quick contract amendment soon to allow for that additional funding to go to you guys. And it's work that you guys are already doing, making sure that people can have access to vaccinations, by securing transportation or helping them with finding places to get the vaccine, and just providing information in general. So that is coming soon, because it ends June 30, so we have to rush. Now, sorry, upcoming events. Our next technical training and assistance will be June 22nd at 11 a.m. As promised, we're bringing the topic effective use of social media and measuring results. The speaker will be Oclesia Renee Diller, our very own expert in that area. She will be sending soon an email with a prep work. We want to hear from you if you have specific questions. This is going to be a very hands-on training. So we want to know if you have any questions on how to do things in Facebook, Twitter, and other social media platforms. Let us know, because she's going to show you how to do it. So this is going to be very hands-on. Please forward the invite once you get it to anyone within your institute, your clinic, so they can also participate, and we hope to have great turnout. Now, the annual conference, we are so excited about this, September 28th to the 30th. We actually are confirming a pre-conference on September 27th. Thanks, we're going to be providing the topic mental health first aid. That is an 8-hour long training. But guess what? Our friends from Mental Health America will be, facilitating this training, and the cost will also be covered to our members. So the stay, the food will be covered by us. Materials will be covered by Mental Health America, since they also have a grant. So people could be, especially those that are not in West Tennessee, because we're going to be in Memphis, if they have to arrive on Monday, that will be covered by us. It's at the guest house at Graceland, and we are very excited about this. And we hope to see the 3 presenters that we have today joining us at that conference with their, area, so they can talk a little bit more to you all. Any questions so far?
Mental health first aid.
Yes, Mental Health First Aid, and it's with Mental Health America. And Paula, we need to talk to you to see if you want to present, your organization wants to present, and we want to hear more from BrainLinks and other associate members. So we will be touching base with you soon, guys.
And I'm sorry, but I have to jump. I have to go. We are going to be sharing a lot more about this. So stay tuned, and thank you all our presenters. This has just been an amazing, opportunity to learn about how we can all work together to serve the people that we care so much about, who need the services you're providing so much. So have a blessed day.
Don't forget to complete the evaluation. We need your feedback.
Absolutely.
Thank you all.
Take good care, everyone.
Thank you all. Bye-bye.
Thank you.
Bye.
Bye.